My name is Sharon. I'm 50 years of age. I live in Cork and I'm a legal cost accountant. So that's what I do. So today I'm just going to speak to you about my own experience with SCAD. I know most people here will have had one themselves, and everybody has their own experience, and some will be probably, very different to mine. Some may be similar. So I'm going to talk a little bit just about the background to the event, and then the SCAD event itself. Then I'm going to talk briefly about my experience at the hospital, my post-SCAD experience, and finally what I've learned from the experience, in the hope that it might help somebody out there. So I suppose I'll start with the background. So I suppose leading up to the SCAD, I would have worked in the IT sector, and I also worked as a youth and community worker for many years. And then when I was 39, I was kind of encouraged. I was doing a night course in youth and community work, and I was encouraged at UCC in Cork to progress and do a degree. So I actually gave up my full-time job and I went to college full-time. I was lucky enough to get into law. So I did a degree, and then I did a master's after that. And during that time, my partner, who was a plumber, he was kind of encouraged by me going to college. He always wanted to be a doctor. So he decided to give up his job, did his leaving cert, and then went down the route of medicine. So we were both in college then at the same time. So that was a bit of a struggle financially. There was a lot of pressure then with exams and getting into a routine of studying. We were both out of school for 20 years. So we were going through a period, I think, of, some difficulty. We had to sell the car, and we're trying to make ends meet. We were both working part-time in the college as well as trying to get through our degrees and that. So then when I finished college, I took an unpaid internship with NASC. They support immigrants. They're an NGO here in Cork. And then from that, I progressed. I was, at that point, we needed money. So I decided to apply for a legal secretary job. And it was a small firm, a legal cost accountant firm here in Cork, and the only one actually in Cork. And I progressed from there then to legal cost accountant. I did my training. So I was in the middle of doing my training when my SCAD occurred. So it was my birthday, as Eileen said. And myself and my daughter had been in town doing a bit of shopping, got a bit of lunch, came home, everything was fine. And I bought a pair of shoes. Everyone asks, oh, what were you doing when it happened? It's so embarrassing. I was literally leaning over, putting on one of the shoes, trying them on, and next thing I got this sudden rush up my chest, in my esophagus, this sudden pain. And it felt like really bad indigestion at first. So I stood up straight, I took a few deep breaths, thought it was going to pass. Then it wasn't passing. My daughter became worried because my face kind of changed colour. And she was saying, no, I think this is something serious, ma'am. Maybe we need to call an ambulance. And of course I was saying, no, I'm fine. It's just indigestion. Started drinking water. I don't think it made it any worse, but it certainly didn't make it better. And then my daughter was getting really panicky. So she rang my partner, who at the time had just literally started his internship year as a doctor. So he basically started saying, oh, women can present differently with heart attacks, and it does sound like you're having a heart attack. And while I was on the phone to him, I started then to get like pins and needles in my hands, and I got a pain across my jaw, bottom of my jaw there. And I think I kind of knew then it was something more than indigestion. But I was still refusing to call an ambulance. I kept saying, I'm not going to waste people's time going up to the hospital with indigestion and all this. I just really didn't believe it could be possible. I was having a heart attack. Luckily, James is on his way out, and he came out immediately to the house, gave me 300 milligrams of aspirin and told me, get into the car. So we got into the cab. He was after getting the cab out, and we went straight up to the A&E. Now, I think I was fortunate when I presented at the A&E, because he went to the desk and basically told the nurse at the desk that he was a doctor in Tralee University Hospital, and I was his partner, and I was showing symptoms of a heart attack, and he spoke for a few minutes to the nurse. So I wasn't waiting very long at all. I was seen almost instantly, and I think they took it seriously too, because of the fact that he was a doctor, although be it an intern. So I was taken in at that stage. Then I was given an ECG, and that was abnormal. So they allowed James then to come back into the room. The triage nurse called him in then, said he could sit with me. He told me what was going to happen. He kind of knew the procedure. So he said, look, here's what they're going to do. They're going to take bloods now, and this is what they're looking for. They're looking at these troponin levels. And he said then they'll have to repeat those tests in 6 hours. So I kind of knew what was coming, but I was still in complete denial, thought this isn't a heart attack and wasting everyone's time here. So anyway, the time passed, the 6 hours, and the repeat tests then were also abnormal. And during that time, while I was waiting in the A&E department, a junior doctor actually said to me, no, I don't think it's a heart attack at all. So I'd really kind of relaxed at that point. My pain had subsided a little bit. So I kind of thought, yeah, look, I was really feeling bad then. I was thinking I've really wasted everyone's time here. The A&E was fierce busy. And then my partner and my daughter went off to get something to eat because they'd been with me all day. And then the senior doctor from the A&E department came in and said to me, oh yeah, it was a heart attack you've had. And I just kind of was shocked then. I couldn't really take it in. So she told me that I'd have to stay in the hospital, but they didn't have a bed in a ward, so I'd have to stay in the A&E department. So I slept in the A&E department that night, and then they found a bed for me the next day. I went for my angiogram the next day then, and I think it was about midway through the Sunday, I was sent for the angiogram, and then that's the first time I heard the word SCAD. So the cardiologist, Dr. Eugene McFadden was his name, he basically kind of showed me the angiogram on the screen, and he briefly explained what it was. I wasn't taking it in. I was in pain having the angiogram. My arm was bent back in a funny position. I was still in shock at the whole thing, that this was a heart attack. And I don't think I really took in what he said. So when I went back to the ward, I said to the nurse, could you explain to me kind of, what a SCAD is? And she said to me, look, the doctor will be doing rounds in the morning. He'll come and you can ask him any questions then. So I said, grand. So the Monday came, and then rounds came and went, and no consultant came to see me. Nobody came to see me. And as the day went on, I started getting really upset then, because I was thinking, I don't understand what this is. Am I going to have another one? They were monitoring me continuously then. I was, the little ECG that you're attached to the whole time. And I was in such a panic. I rang my partner, James, and I said to him, I don't know what to do. I asked the nurse, and I don't want to be annoyed. And he said, oh no, he said, tell the nurse that you'd like some information, could somebody come and talk to you? And he said, you're entitled to know what's going on. He said, so just ask. And he said, they'll be very helpful. And so when I got off the phone with him, I called the nurse then, and she was absolutely lovely. And she said, oh, there's no problem at all. She said, I'll get somebody to come and talk to you. And so then the registrar came up and sat on my bed, and he had a printout of the angiogram, and he literally talked me through it. He was so kind, and drew a picture on the back of my heart and actually showed me what had happened to my heart then. So I felt a little bit more relaxed then, because I understood then what had happened to me. I was able to ask him lots of questions. He stayed talking to me for a good few minutes, and then I kind of relaxed a little bit. So overall, my experience was positive in the hospital, but there were one or two things that was one thing. I think being left not really understanding what had happened, not really being given enough information. That was a bit upsetting. The second thing was I was put on a ward with 4 men, and they were all, some were elderly, some were young, but I was the only woman there, and that was very intimidating. Now, the nurse did move me then to another ward with just 1 man, but that was still, I was very nervous going to sleep at night and everything like that. So I thought that was, I know they're short of beds and stuff, but that was a bit, you're already after going through something traumatic, and then I suppose you don't want to be worrying about other things like that as well. So that was the only other kind of negative thing. So anyway, to shorten this down a bit, I was kept for 5 days in the hospital. And before I was discharged, a nurse came and spoke to me about the cardio rehab and about aftercare. And there was no leaflet. Now we have a fantastic leaflet on SCAD, which gives us loads of information, but there's no leaflet or anything at the time. She literally just gave me some written information on the cardio rehab and talked to me about what exercises I should avoid. And that was it. And then the different consultant came and saw me. Mr. Kelly was his name. And he told me I'd be taking aspirin and bisoprolol, and that I was to continue taking that. And that was it. I was discharged. So I went home, and I was kind of in shock. I think it took a few days for it to settle in. I was ringing my job saying, oh, I'll be back next week. Thought I was going to be fine. I still had chest pain and everything, but I thought, I'll be fine. So then I think I had to go back to my GP, and my GP said, oh, you can't go back to work yet. She said, no, she said, you have to take at least a month off, which kind of shocked me, because I'm used to being busy and active, and this was a big shock that I was going to have to slow down and rest, and I couldn't hoover, and I couldn't do this, and I couldn't do that. So I found that a real struggle. And when I was at home, I was still trying to do things, the way I always normally did them. And my partner, that was really upset, my partner and my daughter, Robin, they were both saying, no, grabbing the hoover off me and stopping me from doing things and telling me sit down all the time. And I found that really, really difficult. And then I think I started to take seriously how they were feeling. They were getting really upset. So I did start to slow down a bit then and try and kind of take my time getting better. But that took me a few weeks before I started doing that. I really was trying to just get back on my feet. And a few people, not my family now or anybody, a few people had made comments to me about, oh, it wasn't a real heart attack, because the fact that I was walking around and I didn't have to be resuscitated and things like that, people just thought, oh, it's not a real heart attack. It's not an important thing, you know. So when that was minimized, that made me feel more guilty then about the way I was feeling inside, that I was very emotional all the time. I was kind of in shock. And physically, I really wasn't able at that point to do the same things I always did. So I had all these mixed emotions. I wasn't sleeping. My anxiety levels were going through the roof. And I kind of felt like I had nobody to talk to. I couldn't tell people how I was feeling because I didn't want to worry my family. I didn't want to worry my friends. I didn't want to be a burden to anybody. I felt like nobody really understood it. So the group then, the Facebook group, was absolutely fantastic, and the WhatsApp group. And now I didn't interact very much with the group, but I did watch and listen and, you know, read people's comments and things like that. And they were really, really helpful to me early on, you know, just kind of, you know, directing me towards information and providing support and help. And so that was really great. But I also felt too that I overdosed a bit on information at the start, and that made me more scared then of having another SCAD. So I kind of started to avoid then taking in information for the first maybe few months, because I just felt I wasn't ready, you know. But then as I kind of became stronger over the months and I stopped worrying every time I got a chest pain that it was another SCAD, then I wanted to know everything about it. So I just kind of took my time. I started to explain to people, look, I can't do this, I can't do that, I need to slow down a little bit. And people were great. People were only too happy to help, really, and you know, take things off my plate in work and at home. So so that's really kind of my experience. So I suppose the thing I wanted to draw people's attention to this evening would be that I suppose I recovered. It took me probably about a year before I started to feel like myself again. And I was hiding an awful lot of things from other people. It was only when I did start to really talk about things to my family, myself and my partner started going for walks every evening. We hadn't done that in years because we were both so busy. We kind of drifted a little bit, you know, both so wrapped up in what we were doing. So that was really good because we started I opened up a bit more about what was going on with me. He opened up. Then I started talking to my daughter, and she started telling me all her worries. And about that she was worried about me having another one. She was worried about maybe would she end up having one. So things started to get easier. Then I think the more I communicated and the more they communicated, and we kind of understood each other a bit better. Besides the fact that we were getting out every evening into the fresh air and into nature, that was really helpful. I was getting exercise, and bit by bit, slowly, I started to heal. So what I would say to people that maybe are new to the group, maybe have just had a SCAD, or maybe they're a few years in now and maybe they're still worrying all the time, or they're dealing with maybe a lot of things still, I'd say one thing to you. There's a lovely scripture I came across, 1 Corinthians 13:4, and it says, love is patient and kind. So most people, when they think about that, they'll think about loving other people. But today I'd like to tell people, try and love yourself like that. Try and be patient with yourself and try and be kind to yourself, because I didn't do that at the start and it really hindered my progress. And I think if I'd have been a little bit more patient, a little kinder to myself, it would have helped a lot. And it did help when I started doing that. Take the time that you need to heal. Try to focus on doing things you enjoy as well, because I started to realize all the things I wasn't doing anymore that I used to enjoy, like playing the piano and even go for walks, things like that. Try to find time to do those things again in your life and focus on those important things and talk to your loved ones. It'll not just help you, but it will help them as well. I didn't realize that. That became very important to me.